One of the commonest things that we get asked here at Skinovate is about darkness under the eyes, or dark circles under the eyes, or shadowing under the eyes. Now, this problem is threefold. Firstly, there's usually a groove under the eye. We call it the tear trough because it would be where the tears would flow, and that's a contour defect in the skin. What that causes is a shadowing effect. So when the light, usually from above, comes across the face, it causes a shadow, creating a dark, circled, tired look. The second thing is the skin under the eye can be slightly pigmented. Obviously that's different from culture to culture and race to race. So a little bit of fading cream under the eye can help fade that skin as well. Some skin is translucent and you can see some of the redness from the veins underneath coming through the skin, and that can add to the darkened appearance too. So if there's a contour defect, we put a dermal filler in it and that gives a massive improvement. Then if the skin is pigmented, and you know that just by stretching it a little bit, we've got custom made bleaching creams that we can use that are safe under the eyes. And very rarely we use a little bit of vascular laser. We can usually improve that by about 40% in a 5-minute treatment. Fraxel laser works by placing tiny little heat columns in a pixelated way in the skin. What this does, it forces your body to create new collagen, new elastin and non-pigmented skin in these areas, giving you a permanently freshened and more youthful appearance. Even with the best intentions and in the best hands, firing lasers on skin can result in adverse events, namely redness, bruising and scabbing, and very occasionally blisters. It's very important to be in touch with a doctor during this time. Skinovate has been run by myself as the medical director since 1996. We operate lasers, but we have full medical backup. If you get one of these complications or side effects early, you can make sure that they're short-lived without any permanent marks on the skin. Unfortunately, out in society, there are lasers being used by not very well-trained people with no medical backup. They tend to come to Skinovate and we see people a little bit too late. We can often help them, but it's about prevention is better than cure, and early intervention if you get a side effect, which unfortunately occurs from time to time. Even though Melburnians are 4,000 kilometres away from the equator, pigmentation seems to be a big problem. The person will come in, sit down at that chair opposite my consulting desk and say, "Doctor, I've tried everything. I've had facials, I've had laser, I've had this and that, and nothing seems to work." They tend to have spent $2,000 or $3,000 by the time they come in and see us. What I have to do is go back to basics and give them treatments that work with solid advice. We get custom-made fading creams made from one of the hospitals. These have to be used under strict supervision with strict guidelines. I print them out and go through them one by one with the person. With the right kind of fading cream for the right kind of person, these are not the over-the-counter ones, these are much stronger. You can get a 30 or 40% improvement in the pigmentation in as little as 4 to 6 weeks. On top of that, we've got collagen induction lasers like Fraxel that can take out old little heat columns of pigmentation and allow your body to heal with new, clean, fresh skin. It's difficult because the pigment cells have a memory and they like to overreact to ultraviolet light. So ongoing sun protection with a hat and a factor 50 sunscreen is crucial. You can undo several months of really good fading and cleaning up of your skin with 1 hour's carelessness out in the sun. Pigmentation is traditionally a difficult topic, but since 1996 I've been building up protocols and ways to get people through what can be a very difficult and distressing time. Let's talk about scarring. Acne scarring, for instance, very common and a lot easier to fix than most people think. Sometimes the most severe looking acne scarring is the easiest to fix, and sometimes the one that doesn't look too bad is slightly harder. When assessing a person's skin with acne scarring, if you just gently stretch the skin, if the scarring seems to drop out, that tells us that a dermal filler injected just under the skin will elevate that area of scarring and smooth out the skin a lot. It works really well and very quickly. So in the average acne scarring person that comes in, we can get a 60 or 70% improvement in a couple of minutes' time. Some scarring is a little bit more difficult. We have lasers that go over the skin and stimulate new collagen production under the skin, because basically the acne process has destroyed the fat under the skin, creating these little divots. And so by stimulating new collagen, which has a very long-term effect, you can improve the scarring quite a lot. A combination of some dermal fillers and some collagen induction laser works quite well. There's a few tiny little extra techniques. One's called subcision. Sometimes the scars are really stuck down and really tough. You can pop a little bit of local anaesthetic in the area and get a needle and just sweep it underneath the scar, and you can actually hear and feel tiny little fibres of collagen and scar tissue being broken, and the scar slowly just elevates up before your very eyes. Scarring, very common. Acne scarring, probably the most common, often a lot easier to treat than you think.